Madam Chair, I am here to discuss a special order of business that I had put on the agenda yesterday, the protecting seniors.
Can we get the protecting seniors on the, can we get this motion, thank you, on the screen? Okay, it's on the screen, you all had it from yesterday, right? Okay, proceed.
First, this is called protecting seniors because that's the first thing we need to do. But this resolution goes much further than that. We all understand, as we've heard throughout the last 2 days, what is going on in healthcare in our country. This is an economic crisis for every single family in the United States of America. And we have to first and foremost make sure that we're protecting our seniors. But let us be clear, this is an industry. This is an industry that should be ashamed to call itself a non-for-profit in hospitals and medical providers in so many parts of this country. How are you a non-for-profit hospital system when you're giving your CEOs $8 million, $9 million, $10 million bonuses? How are you a non-for-profit system when you're owned by a private equity firm and it's your quarterly profits that are making decisions on behalf of the care of the people inside of your hospital, not in their best interest, but in the best interest of that bottom line? And we know there are people, we know that their plans are there. 2025, as Zeph just spoke to. As we heard yesterday from this stage in our phenomenal conversation, what private equity is doing. Wall Street is salivating at this moment, looking at hospital profits, looking at insurance companies' profits, and looking at profits of medical groups. Enough is enough, because when we go to the negotiating table, this is what we are dealing with. We deal with this constantly. Oh, we want to give you a raise, but we had a double-digit increase in your health care. And we hear it constantly, and it never stops, and it's getting worse. So the first thing that we need to do is, of course, protect our seniors. Those who have already paid, they've paid in throughout their careers into Social Security and Medicare, they should never be allowed to diminish those benefits for any reason whatsoever. None. Second, I am sick and tired of listening to so many elected officials tell us, oh, you're right, it's horrible what's going on with healthcare. Well, God damn it, do something about it. We are all in support of a national health care plan. There seems to be no political will, but that's not stopping you. Let's pass legislation that says, no, you can only make so much in profit hospital. You can't just keep bleeding out, and I mean it that way, bleeding out your patients because you want more profits. Right. Enough with them always telling us, you're so right, it's so horrible what's going on in healthcare. They have the power to do it. So the AFT and all its affiliates should be saying to every candidate, what is your position? And don't let them get off with, you're right. We're going to say no. What are you literally going to do about it? What legislation will you support? How do we start taking apart these issues in healthcare that are hurting all of us? Federal legislation. This is the biggie. We're on the defense. Hell no. Let's go on the offense. Let's go on the offense. We know what they've tried to do to Social Security and Medicare already in this past 2 years. We know what they want to do if they get control of everything. Well, I want the American people to be able to understand what their elected officials are trying to do. Because I know what the American people think. You all know what they think. Do they want to pay more for their health care? No. But they want to maintain high-quality health care. So we need to we have to constantly monitor and put a big attack on anything that's out there. And we can do this. And again, we need to start at the right place, which is those who are already in jeopardy, and those are our seniors. We have to do everything in our power to hold that line. And we need to pass, the first law we need to get past is, there can be no diminishment of any Medicare or Social Security benefit to any retiree. None whatsoever. And that's what we need to do. And Madam Chair and the body, I would hope that you will support this resolution, because as we're doing in so many other places, it's time to go on the offense. Let's call them on their crap, and let's hold everyone accountable who's there, because we know our health care is a human right. Thank you.